You, Governor Leavitt,
Thank
for
you,
being
Rob.
here. It's a great honor to have you here. And I just want to ask, looking around this room, how many of you are coming to the Dallas Fed for the first time? Okay, wow. So we got a lot of, and how many have been here before? Okay, wow. So you can see we're thrilled to have you all here. And with that, I'm going to get right into it. And you've had a fascinating career, not over yet. You were in private business, in family insurance business. And then you became governor in 1993. What caused you to go from private business to want to run for governor and then be governor of the state of Utah?
Actually, it was not a planned event. I had started as a young person, just as somewhat of a hobby, actually. Actually, it was not a hobby. I was drafted into a political campaign. I was in my mid-20s. My father was in the state legislature. And at the last minute, he was persuaded he should run for governor. And there was a moment in time where he needed some help, and I left my work for a week and started to help him organize it. And at the end of the week, I said, "Do you need me to keep helping you?" And he said, "I really would appreciate that." Turns out we couldn't find anyone who would work as cheap or as hard as me. And I ended up managing his campaign. And that moment set off a series of quite unplanned events where about every 2 years, I would somehow be snagged into the political process, at the same time building a business career. And at some point in time, it became evident that I either needed to get out of politics or I needed to get in. And I had been involved in the education world. I'd been appointed as a chairman of one of the universities and then on the board of trustees of the Regents, which is the governing board. I just become fascinated by public policy. Suddenly there's this opening to be a governor, and I thought, if I really wanted to do anything in education, that'd be the place to be. And oh, by the way, there'd be the advantage if I decide whether I was in politics or out of politics. And I decided to run, and I'd not run for anything before. The sun and the moon and the stars all sort of lined up at the right moment, and I was elected. And I must say, while not planned, it was an extraordinary experience, and one I will always be grateful I had.
So what was the biggest challenge you faced as governor of the state of Utah?
Well, I would say in terms of the overall course of that period, there'd be a whole series. We were just talking about the economy.
Yeah.
And I asked Rob, how has it shifted? How do you describe the shift? And if you asked me a question about what were the most profound challenges, your answer was you have to look at it a slice at a time.
Yeah.
And I think the thing I loved about being governor was that it was like eating at a giant smorgasbord. One day you'd be dealing with education. The next you were dealing with human services. Then you were building roads. Then you were dealing with prisons. Now, all of this could happen in any given day.
Yeah.
And I loved that.
Yeah.
Because you could begin to see how it all sort of came together and how society worked. Some of the things that I found challenging, we found ourselves in a position where, like a lot of states, our infrastructure was deeply challenged. We had roads that were in disrepair. We had the Olympics coming, and the whole execution of the Olympic Games and the coordination of that may have been one of the most important periods in our state's history, because it was a kind of coming of age of our state, and it wasn't easy. The Olympics brings a lot of unique challenges. So I would say then the whole idea of managing growth during a period of sustained, intense preparation for the Olympics may have been one of the more unique management periods.
So we were talking earlier how the insurance background is actually a pretty good background to be in the public office and to be a governor. You might comment on that.
Well, I was telling Rob that the disciplines of risk management, the ability to understand the relationship between risk and reward in quantitative terms, I found to be a quite useful skill that I have applied throughout the course of my public service. Many of you in this audience, I know, have exercised those same skills, and my guess is you'd find it just as valuable.
So you founded the Western Governors University. So you might explain to the group, what is the Western Governors University? Why did you start it? This is when you were governor of the state.
Yes.
And why is it important?
I mentioned earlier that I got into politics in some respects because I was interested in education. And one of the things I had observed about higher education was it just had a model that I couldn't see how it could scale rapidly enough to meet the needs of society as we all begin to retrain ourselves. And I was among a group of governors who concluded we really need to think about how we serve these populations who are currently underserved. And the internet, of course, was just beginning to become such a big part of our life, and we could see that a fundamental shift in the economy that was going to occur was having knowledge. Instead of having people go to campuses to learn and to process information, it was going to come to them, and that we could use the internet as a means of being able to deliver it.
Yeah.
There was a second component that we thought unique, and that was troubling, and that is that the system tends to measure progress on the basis of how much time a student spends at a task. Now, there are certain measurements along the way, but it's really a system based on seat time. And we resolved that we would create a university that would be done online, and that they would, in fact, we would use the technologies of the day, but we would measure progress differently. We would measure it by competencies demonstrated. And that we would create a university that would have focus in just 4 areas: teacher training, health, IT, and business. And so Western Governors University was born in 1998 with its first student. Today, they have 115,000 students. It's growing at about 25% a year. The tuition is $6,000 a year. The average bachelor's degree takes 3.1 years. Wow. The student, the average age of a student is 38 years old. They're more than half of them are the first student in their family to go to college. Yeah. They're fully accredited by all of the regional accreditation organizations. They now
basically self-funding through revenue.
There's no tax dollars that go into this, and yeah. It's about the third as much. The cost is about a third of what an average state university would be. And it's all driven by the fact that it's scalable. I'm very proud of what they've done, so I should not talk too long, but one of the things we began to do was to say, it was built by 19 governors, and the governor of Colorado and I were the 2 sort of primary leaders of that. Texas was among those. Governor George W. Bush was an early, a proponent. We started the organization by getting 19 states to put up $100,000 each of capital. That's the hardest money you'll ever raise. We then went to Silicon Valley and laid the vision out for them, and a group of people in Silicon Valley wrote checks on the spot and said, this is what we need. The system is not moving, it's not scalable, basically.
Could you see, and some of us, when I was at Harvard, we worked on a thing called HBX, and we've got, it turns out, Sal Khan Academy, we're having him speak here actually in May at a conference we're doing. Can you see this get to a tipping point where all of a sudden online education is going to meaningfully disrupt bigger portions of higher education, or can you see that happening?
An interesting decision we had to make. We were governors. We were trying to figure out really how to disrupt higher education in our own state, not in the context of trying to eliminate them, but to try to stimulate
because you were worried about access.
Exactly what we were worried about, particularly for the people this university serves. I might add, I want to say that it is now the largest trainer of teachers in America.
Wow.
It's the largest provider of math, science teachers in America. It's now done the same thing with nurses. We'll be the largest producer of nurses in America. But we had a decision to make, and your colleague, Clayton Christensen, who has a deep interest in higher education and has continued to follow this, wrote the book, the Innovators Dilemma. And the Innovators Dilemma was, if you put this inside a traditional system of higher education,
Suffocate it.
it will suffocate. So we decided, let's put it into its own unique corpus, and we formed it in the way that I've described. And we got it to a critical mass, and now we've started to, it started to spin out state institutions. For example, Governor Perry instituted Wgu Texas, and you might be surprised to know, I think there's about 11,000 Texas students in Wgu. But here's the point. Technology is disrupting higher education.
Right.
It may not have yet affected the economic model, but it will.
Yeah.
Because it's the day of, just not very many people can afford a $40,000 freshman year. And state universities are becoming so expensive that it's become much more difficult for the segment of society we really need in order to lift our economy. And if you can deliver a bachelor's degree in 3.1 years, and you can do it for about a third the cost, and if you can have employers extraordinarily happy with the graduates, there's something there. And so I'm very proud of what they've done, and I think if you haven't explored this, you might find it interesting, and you probably have people who you employ now who have graduated.
That's great. Interesting. In 2003 then, you became the EPA administrator. So how'd you go from, you were governor and then you went to the EPA, how did that happen?
So I'm governor of Utah. I've been there for just under 12 years, and I'm thinking about, should I do this again? And I get a call from my friend George W. Bush, and he asks if I'll come to the White House, and he has a problem that he needs solved at the Environmental Protection Agency. And asked if I would consider coming. It was not at all what I thought I would do.
And did you have any background in this?
Well, if you're governor, and particularly if you're governor of a Western state, there's not an environmental issue you haven't dealt with. And I actually had done a fair amount of thinking about this, and had done some writing about it, and had been an advocate in particular areas related to natural resources, and had, I suppose it could be safe to say I had built a bit of a reputation in that area. But it wasn't what I thought sounded like a great time, to be honest. And when he went, great little George W. Bush story. So he said to me, I'd like you to come be the head of the EPA. And I said, Mr. President, let me tell you, when I was in high school, I think I was the best catcher on the team. But I'd rather play shortstop. If you're going to be the catcher, you got to strap on all that gear and put the face mask on, and you get foul tips and so forth. And when I was a senior, they finally let me play shortstop. But every once in a while, the existing catcher would have to pitch or was sick or whatever, and I'd strap them on and catch. And it sounds like to me, what you're asking me to do is to strap them on and to catch. And I'd be happy to go over to EPA and do my best. And I might add, I had a fantastic experience there. But I said, I just want you to know I'd rather play shortstop. So I spent a couple of years at the EPA, and I'm so glad I had that experience. It was a gift. The president got reelected about a year and a half later. On Sunday morning, in between the election and the new year, I get a call from the White House. Would you like to speak to the president? Yes, of course. He said, I'm going to be making some changes in the cabinet, and I'm wondering if you'd be willing to come over and occupy the role of Secretary of Health. And he knew that was an area of real interest of mine. I said, oh, yes, sir, I would. He said, well, be here at 9:30. Don't tell anybody. We like to make our own announcements here. Okay. Thanks, Mr. President. Just ready to hang up, and he said, as you know around here, the president always had a nickname for lots of his friends, and he said, Mikey, one more thing. Would this be shortstop? He had remembered,
yeah.
over
I'm
the
not
course of
surprised.
nearly 2 years, and so that was how they both happened.
So let me ask you, before we leave the EPA, so I guess I don't need to say, we're having some interesting discussions in this country and globally on climate change. And by the way, in the state of Texas, we spent a lot of time dealing with this subject because of hurricanes and droughts and floods, and it is already having a big effect, and we're worried that the tail risk and investments need to be made. What's your view as you sit here today on climate change, and what approach should we be taking in this country?
Well, I came away from 2 years at the Environmental Protection Agency fairly well persuaded that a couple of basic things are happening. The surface temperature of the Earth is rising, and there's little doubt in a rational mind that civilization and human beings are having a profound impact on that.
Right.
Obviously, we're unexperienced in dealing with this. There are a few things we still don't know. What we don't know is what impact are the things we're doing going to have. And I also came to be very well acquainted with the political side, not just domestically, but internationally, on this issue. I remember sitting with the environmental minister of China. Actually, this was while I was governor, not while I was at EPA, but I began to ask him about climate change, and he said to me, you have your economy, and it's okay if you want to slow it down, but don't ask us to until we have an economy. And I'm not at all dismissing the critical nature of the problem, but I was somewhat involved then in the negotiation that would occur between nations in developing these large international consortiums or treaties, and it just became very evident that there were problems in this. And one of the problems is that in the United States, when we make an agreement, we keep it. And not everyone who signs those agreements do. And they're very willing to have us take actions that in their mind would be in their interest with no intent actually of keeping theirs. So I came away persuaded this is happening. I came away persuaded we need to be acting as good citizens, but we can't do it naively because, like so many things, there are trade-offs here that have profound economic implications, maybe in the near term, greater implications than climate will have in the long term. We just don't know that yet.
So one last question on this. We had Greg Mankiw, you probably knew when he was there, who as well as Secretary Baker and Hank Paulson and Bloomberg, et cetera, who've called for a carbon tax. And Greg Mankiw was here a few weeks ago and explained very articulately why, we should have that. Do you have a view on whether we should be doing a carbon tax?
Just a little little history connection. In the 2000 campaign, then Governor Bush made a speech as part of the campaign, essentially saying we will regulate carbon.
Wow.
And Christie Todd Whitman, who was the governor of New Jersey, who became the head of the Environmental Protection Agency a couple of months into the administration, prepared and had vetted at the White House a speech essentially announcing that the U.S. would regulate carbon.
Yeah.
And there was active discussion of a carbon tax.
Yeah, I remember this.
And she gave the speech, and everything from there is subject to some different stories, but within a couple of hours, there was a retraction of that.
Right.
And and actually, then I became head of the EPA.
Yes.
And I did not pursue a carbon tax.
Yeah, I gather not. All right, I'm happy.
That's the last time I thought about it.
I've learned in this job to be politic, and I will leave it there. So, as Secretary of Health and Human Services, What was your biggest challenge in that job? And I know one of the major things, among many others, you did is Medicare Part D and help seniors and others pay for prescription drugs. But what was your biggest challenge in that job?
Well, let me just say generally, many of you will have had some version of public service, and so you'll resonate with what I'm going to say. It's just such a privilege to be involved in all of these things, and at that point, it was a remarkable period of time. So Katrina happened,
Yeah.
and we had pandemic influenza began to happen. Then we had Medicare Part D, where we were rolling out a new benefit for 43 million seniors. All of those happening at one time.
Yes.
And I think that may have been the most significant challenge. Again, it wasn't just one thing.
Yeah.
It was the fact that you have 43 million citizens looking for their pharmacy benefit at the drugstore on January the 4th, and they're not getting them. You know, that's a crisis. And at the same time, you have half the United States wiped out by a hurricane. And I mean, it was just a fascinating time. And the composite of those, I think, I'd have to say, were the most
And the scale.
challenging. And the scale. That's a great way to reflect that.
So let's say you watched, and we both know. I'm from Kansas, so I know Governor Sebelius and work with her in some capacities. And you were saying you just saw her, the Affordable Care Act. Then, so you watched from, I guess, from outside the government, the enrolling of the Affordable Care Act, and now you've seen the controversy. What's your assessment of what's your assessment of the Affordable Care Act and this debate we're having right now about individual mandate in particular?
I will comment on that. I would like to say that I urge people when we have this discussion not to think of health reform as being a political event that occurred on a particular date, not to think of it as actually what happened in 4 years. Health reform is something that is scaling over the course of 40 years. And the truth is, we are about 25 years into a 40-year transformative period in healthcare, driven by all of the facts that were laid out by the introducer earlier. I think if you look at this as to how we got here, I think you have to look back to the 1960s when we started Medicare and Medicaid, and it was a great expression of our country's sense of compassion. We want to live in a place where people are cared for when they're sick and when they're injured, and we established a plan to accomplish that. But in doing so, we laid out some policies that turned out to create incentives that were unaligned, that began to fuel spending at a rate we just hadn't contemplated. And in the early mid 1980s, we began to try to change that from a process we now refer to, and you've all experienced this in the hospital world. If you have a procedure, there's a billing for that one procedure, and over again, you'll have 200 procedures if you just go into the hospital, and that has just inspired only one thing, and that is everybody has an incentive for more. If you're a provider, you get paid by doing more. If you're a physician, you get paid. Or rather, if you're a patient, you want to have more, and you've got a third party paying for it. There's no connection between these two. And so we now find ourselves in this very difficult position where for 30 or 40 years, prices have been escalating at an unsustainable rate, and we're trying to figure out how is it that we sustain this human value of compassion. And we're confronted now by another force, and that is the potential that our economic leadership could be challenged. So you've got this collision between these two important values, our sense of compassion and our economic leadership. And when it comes right down to it, if you want to look at the political debate around healthcare, that's what it's about. It's about that collision, and you might go one other layer, and that is, what is the role of government in our lives? Do we want government to control that? And But we're now at a place where it is beginning to have. No one would know this better than the people in this room. But there's no place on the economic leaderboard for a country that spends 25% of its gross domestic product on health care. We're not quite there yet, but we're competing with countries who are spending a third of that. This is not about health care. This is about the economic equation of America.
So one of the analyses that I've looked at when I used to look at this more closely, but still today, is one of the big differences between us and other countries on the percentage of GDP we spend is the fact we've got a big insurance intermediary industry, and they're, I guess, quote unquote, single payer. And their outcomes in some cases are better than ours, but they're paying a fraction of what we pay in terms, or less than we pay in terms. What's your assessment of, and you're seeing in the political debate, and I'm sure in this next election it's going to be a big issue. Is it feasible for us to ever have a single payer system, or does it even make any sense?
So I didn't answer your question about the Affordable Care Act, and I need to do that because it's a very important question. I think when history is written on the Affordable Care Act and Barack Obama, the one thing he will be viewed with, deservedly with credit, is that he got something done. It's an industry that has been simply mired in gridlock for literally decades.
Yeah.
And the ability of the political mechanism to change it has been non-existent. Now, I was not a fan of what they actually came up with in the Affordable Care Act, but what I've come to understand is that it essentially put the molecules in motion. And it may not be what they did that improves healthcare. It may be the iterative process that is set off that will, in fact, improve healthcare. And I think we'll see continued iterative change.
Driving toward what?
So if I were to say, what does the healthcare system look like in the future, I would say this, that we're going to see more and more integration between insurance plans and insurance and healthcare providers. And that gets to some of the administrative component. There's all this billing that goes on. If you could begin to move toward what the industry refers to as value-based care, where you're actually paying for the value that is received by patients. If you're paying for what has actually worked, if you're paying for the amount of improvement that's been made, then you get rewarded. Well, to do that, you've got to begin to have more integration.
Yeah.
And when I say use the word integration, what I'm actually referring to is less redundance.
Yeah.
And more and payment being done on a basis other than just a piecemeal basis where everyone is rewarded for more.
And you mentioned Clay Christensen, so Michael Porter,
Yes.
This is his big initiative right now, is outcomes based, and it would cause different services to be co-located, and may cause you're a fan of that approach?
I'm a big fan of it. In fact, I would argue that is in fact, that's the 40 years. It's going to take us 40 years, but we started on it in the 90s. Michael Porter wrote his book about 2001. Actually, when I was secretary, I read Michael Porter's book, made everybody in the leadership of the Department of Health and Human Services read it, because this idea that we ought to pursue value as opposed to simply more care, and it was revolutionary.
So let me ask one other question, then we're going to open up to the group. So you were a governor and you worked in the federal government. And it's a great privilege, but there's a lot of frustrations. What could the federal government learn from the way states are run that might be instructive? How should things be changed?
Well, first, nearly every state has to balance its budget. And honestly, that is not to be understated. And it forces states to make decisions and to budget against priorities. In the federal government, that is not a problem. That is, so just start with that. The second thing I would say is if things got hard enough that you could just deal with the circumstances we have in the United States as a turnaround, whoever led the turnaround would approach it, I think, as follows. they would say we have to redefine the division of labor here because the federal government is just trying to do too many things and they're too far away from the ability to execute. So why don't we just use a system where we'll have the federal government do fewer things but be supreme in their approach to that, and we'll have the states manage about everything else, and we'll have to tolerate some differences among the way the states do it, but it will allow us to have more sensitivity on execution. And the things we'd have the federal government do is we would have them manage the monetary system.
Yeah.
We would have them manage foreign policy. We'd want them to handle the national defense.
Sure.
Well, every one of you will recognize what I'm describing is the original the constitutional construct of the country.
Yeah.
It was the Great Compromise. But what's happened over the course of the last 70 or 80 years is that the federal government has very cleverly found ways to, in essence, take over all of those local duties. So you have people who are running for president now who are talking about teacher pay. They want to run the healthcare system. They want to manage, and I'm making a very basic argument, but if you want to know the difference, it's the difference that in what a state deals with and the way they have to deal with it and the way a federal government has to deal with things, which is to in essence, collect a lot of money, tell people how to do it, and then send it away.
All right, good. All right, let's go to questions, and I'll come back as we get further. Who has a question? If you do, please stand up, go to the mic. If you don't, I got more. All right, so while we're doing that, what's the biggest thing in the country that worries you going on right now? Maybe it's what you just talked about.
Well, it is. It's driven by that. It is the fact that we went through the entire 2016 election and never had a conversation about debt.
Huh. Yeah.
And I don't see anybody in 2020 who's going to raise it. I don't think Donald Trump's going to raise it because he's been adding to it. I don't think the Democrats are likely to because that's just not their thing. So we could go through an entire second cycle and never have the debt dealt with as an issue, and all of the time it just continues to mount. And I just don't see how we can continue that.
Okay. Yes, sir.
Sir, we could argue that the U.S. has the world's best food delivery system. We have food available, enough nutrition and calories, anywhere from $1 to $1,000. Pick a number. Why can't we apply a market-based system like food delivery to healthcare delivery? What's in the way?
Well, there is, I'd say, a couple of things we ought to acknowledge. One is that we're a divided country. And one of the divisions is that there are people who have a lot of confidence in markets. And then there are people who don't. And then there are people who have a lot of confidence in government and people who don't. I mentioned the fact that I think if you roll all of this up to one big question, the question is what role do you want government to play in our lives? And we tend to use issues that are very personal as the surrogates to have that debate. And we're having that debate right now on health care, and that is very much at the essence. Now, in presidential politics, you win campaigns by carving out very large, simple themes. Build a wall, Medicare for all. But at the root is a question on Medicare for all, for example, is what role do you want the government to play? Do you want it to deal with those issues? Now, you mentioned food. I think it's a great analogy. There's really nothing. We talk a lot about health care and whether it's a need or a right, or whether it's whether it's a privilege or a right. I think it's a need, and there's nothing that would prohibit or should in fact limit government from being able to help citizens meet their needs. But you take food for an example. In food, we have a system to incentivize the production of food. We have a cheap food policy. We're doing everything we can to get food out to our citizens. We have a system that if people can't get food, we'll give them food stamps. If they can't go to the grocery store with their food stamps, we do Meals on Wheels. But there's an example of the way we have used government to organize a social system. Take the military, for example. People need protection. That's another need. We've decided that there really only ought to be one military because it would be bad if they were competing. The consequence is we have that as clearly operated by the government. So food is a system that is organized by government, and the military is one that is operated by government. We're now having a debate as to whether or not we want healthcare to be operated more like food, or do we want it to be operated more like the military? And at the root of this is that question. What role do you want government to have in your lives? And there are deep divisions among that, and it's what drives the differences in the parties. It's what drives a lot of the differences in society.
Thank you, sir.
Okay. Take the next question. Yes, sir.
My question is, I worked in the United States Public Health Service and also with the Medicare Bureau, and was involved when President Nixon was president and he wanted a national health insurance program. My question is, you indicated about maybe a better equilibrium would be for us to go back the way things were when the Constitution and the Great Compromise was made and the police powers were reserved to the states, which included education, health, and everything else. But we had very little help. And right now, with the costs in Texas, if it hadn't been the federal government creating incentives, we would have never had Medicaid. We would have never had many programs in public health. So I think there's a role. The government doesn't have to run it. We don't run Medicare. We contract with people the government does.
So I have no illusion about the fact that we'll actually be able to A, do that, or B, that in its form that I've described it as simplistic, that it would be necessarily the right thing. But as a principle, I think it's a sound one. Let's just take Medicaid as an example. When I became governor, Medicaid was about 6% of our state's budget. Today, in any state, it's roughly 20 or 22% of the entire budget.
Wow.
You mentioned, and the reason for that is that we have essentially taken away from states the ability to manage their programs. We don't create standards for them to meet and allow them to innovate within those standards. We tend to create prescriptions and tell them exactly how they will do it. And it does have the effect, in my judgment, of minimizing the amount of innovation that can occur. Public health is another interesting. That's clearly a local need. What's happened, because we have allowed Medicaid rather, to grow, or caused it to grow, almost everything else is now being pushed aside. Higher education, the percentage of higher education being paid for by states is going down. Tuitions are going radically up because they're having to make room for Medicaid. Public health is essentially now driven almost entirely by federal money, and they also, by the way, tell them how they can spend it. And there's an argument that maybe Washington is suggesting that they spend it on exactly the right things. But this isn't working out very well. I mean, we're now, what have we got? A $19 trillion debt? And what have we got? A $1 trillion deficit? And somehow, you asked about my biggest worry. That's my biggest worry.
Yeah. Okay, very good.
Thank you.
By the way, before we get to the next question, you were just in China. What struck you most about your recent trip to China?
So I was there to speak with a group of academics and government officials, and I've interacted with them for many years, and our purpose was to actually compare the issues we were dealing with. It was fascinating. They started off by talking about their endeavors to get everyone insured. And we'd had actually the same conversation we were just having about if you look at what the role of government is in people's lives, there are a group of well, they refer to it as their social security system, which is their pensions and their health and helping those in economic hardship.
Yeah.
And then you've also got defense and building the economy. So roughly, if you say, let's break these into sort of our compassionate objectives and our economic incentives, those are the two things that compete. And I began describing essentially the same thing as to how I actually showed them a graph and said, let me show you what's happened to our debt over the course of the last 40 years. And I made the case that one of the things that's driving that debt and the amount of expenditures on our social security system is the fact that everything is an entitlement. It's because we're a compassionate people. And so we have made those services the first priority. Nothing else can be paid until those have been paid. And I said to them, you ought to be careful with that. If you're designing a system, and one of the Chinese officials said to me, that's just not a problem here. I said, well, explain. He said, well, first of all, people think about our health system as being a big national system. It's not. It's all run by the provinces. And oh, by the way, if we run out of money, we just dial the amount down that we spend. And then it dawned on me, if you take those two rough areas, we have said in our country, and this is a value judgment that the country has to make, but we have said our compassionate selves, our expression, our Medicare, our Medicaid, our human services, all of those things, our food, that is our biggest priority, and we won't let anything happen until we have done that. And then but we're still we're building up this big debt. In China, what they're doing is they're saying, we want to do all of this we can, but we're going to build our economy. And our theory is that if we can build our economy, we'll be able to do more of that. And so there's two theories of the case here. One is take care of those needs no matter what and build up a debt. And the Chinese version, which is let's build up our economy and it'll bring this along. They're really inverted cases. Now, if you think about the Chinese mentality, that's playing for the long. That's the long game. They're saying, obviously they're not being as sensitive to their people. I'm not here making the argument that they're right, but this is a very important change.
So I don't want to leave this before asking. Some would say, and we spent a lot of time looking at both, the Chinese, where they have overspent, they spend on infrastructure. They've spent it on investments. Mm-hmm. We spend it on, instead, in some cases, tax cuts and other expenditures, not investments.
Some would say that.
Some would say that. I don't know who would. I mean, it's really an obnoxious thing to say.
God bless America. I love this country, and I love democracy, and I love free markets. But I've spent enough time in China to watch their government's really interesting to watch. It's a very corporate approach. They attract people from their universities, and they handpick the best and the brightest, and they go into the government. They are trained. They have a 5-year plan. They are graded on whether they execute or they don't according to the plan. They go back to a university every 2 years, and they're schooled in what the plan is and why the plan is there. It is a very corporate approach. And they can move fast. They're formidable competitors, is what I'm suggesting. Sure. And we can't allow ourselves to not see that and begin to ask ourselves, what can we do to begin to be moving more rapidly?
Yeah. All right. Yes, sir. Sorry.
All right. First off, I want to say thank you for coming out today.
Thank you.
It's a pleasure to hear you speak in front of the Fed. My question actually has to do with a little bit about economics and healthcare. So we spend roughly about 20% of our GDP on healthcare expenditures. Most of what we take in taxes goes towards healthcare, Medicare, Medicaid, and we borrow in order to cover all the other parts of the government expenditures, such as defense, as well as every expenditure that comes up out of that. Is the system going to be sustainable? Even if we roll out into value-based care, it costs too much. Where does the government go from here?
So I mentioned I think we're in a 40-year transition. I think we're about 25 years into that transition. And the transition in my mind is trying to find the golden mean between our compassion and our need for economic leadership. It's basically trying to find the place where we can meet our needs, and it's hard because we're literally having to invent new ways of doing things to get there. And I believe we are in a race. We're in a race between that inventive process of trying to reinvent the way we do things and the economic reality that you have spoken of and others will be able to more articulately than me, and that is that at some point in time, the weight of that will cause us as a country to face some degree of some crisis where we're going to have to make a decision to either choose our compassion and say to heck with economic leadership, or we're going to have to say no, we have to have economic leadership and we'll find ways that we may compromise over here to do it. We're trying to avoid that. And to do it, we've got to invent an entirely new system. And we're in a race to see if we can get it done before there is some kind of event that provokes us choosing.
Yes, sir.
Thank you.
John Bullock, one of the big issues I see, maybe the biggest one in both government and business, is an ability or inability to deal with the long term. And what I see in government, when you talk about issues like the debt, it's hard to convince voters to worry about what the debt is going to be 30 years from now. It's hard to convince voters to worry about what the environment is going to look like 50 years from now. We run into that with issues on repairing our infrastructure. A lot of our cities have issues with public pensions. It's easier we can't give you a raise now, but we'll increase your pension 30 years from now. As a guy that's been an executive in a state and in government organizations, how do you deal with that? And how do you get people to look at the long term?
So the question, Rob, that was asked earlier, which is the difference between states and the federal government, is prescient on this because, and I sort of flippantly said, well, you start with everybody has to balance their budget. The problem is there's nothing constraining any of the long term in the federal government. There is nothing constraining it. There's no requirement to constrain. And everyone can say this is bad and we shouldn't do it, and then they go out and campaign and they do it again. And there's just nothing constraining it. And that's essentially what's going on in healthcare. There's nothing constraining our sense of compassion, and it's a good thing. Who can say we have too much compassion? That's not rational. It's a human value we really cherish. And if we lose it, we lose what's the essence of our country. On the other hand, there's nothing constraining our economic equation. And so I guess what I'm suggesting is if you want to change behavior, you have to change the structure. And that's hard.
Yes, sir.
The notion that spending through entitlements or other demands increases deficits is a problem that I share with you. But I think there's also the other side of the equation, which is that massive tax cuts dramatically affect the deficit and are this most recent one a year or two ago is supposed to add $1.5 trillion. I imagine there are experts here who could pin that down better than I. But you haven't commented on the deficits caused by that tax cut as well as by tax levels in the U.S. and how it relates to other countries. Could you please talk about that?
Well, I'd care not to have to defend the tax cut in those terms because it's we got economic stimulation. The question, and we all love economic stimulation, particularly if you're in politics. And I understand the supply side doctrine, but look, the reality is, it's still. I was asked what's the problem I worry about the most. That's still what it is.
So, last question. So you've had career in the business, public service, do a lot philanthropically in the community. What's your philosophy? Obviously, there's something about your background and your beliefs that have caused you wanted to do more than just be a business person. You wanted to be involved in public service, either as an elected official or appointed official or philanthropically. What's your philosophy on this, and what advice might you give to the rest of us on how we might balance those things?
So I indicated that how grateful I am that I have had a chance to do public service. I found it enriching in an emotional sense, and the reason is because I felt like I was part of something bigger than just me. And I believe that that instinct is alive in most of us. And I've also learned that part of being something bigger than yourself can be accomplished in local communities. It can be accomplished in school communities. It can be accomplished in neighborhoods. And so I would simply advocate for all of us to seek to be involved in something bigger than ourselves. And I've also often said that the best opportunities I have had in my life have come when I was willing to step up and volunteer to do something that no one else was interested to do. I've jokingly told students that it's because expectations are low, but at the same time, it has given me an opportunity to do things that I probably wouldn't have otherwise had a chance to do, to meet people I would not otherwise have a chance to meet, to solve problems that I wouldn't otherwise, and it has enriched my life. And so, Rob, I would say my hope is that we will all try to be part of something bigger than ourselves.
Governor Leavitt, thank you for your leadership, and thank you for being here. Terrific. Thank you.